See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Hello, hello. I see a name up there that says Lauren Underwood. You have had an incredibly busy morning.
We're in the middle of a boat series now, so it's in flux, but we have a little bit of time.
And that little bit of time is highly spoken for. So we were so grateful that nurse and Congresswoman Lauren Underwood shared it with See You Now, especially when she is in the midst of a voting session and running in and out of her Washington, D.C. congressional office. So a little later in the show, when you hear those voting buzzers in the background, just know that's our democracy in action.
I'm Congresswoman Lauren Underwood. I represent the 14th Congressional District of Illinois, and I'm a registered nurse.
I'm Shauna Butler, and this is See You Now. This weekend, we're celebrating Mother's Day. And as we think about our moms and mums, aunts and aunties, grandmothers, and all those maternal figures in our lives, we have this very clear sense that, well, it's been a rough year for moms. How rough? One study published in the National Bureau of Economic Research found that women in the U.S. had less flexibility to work from home, less access to paid leave, and fewer furlough options that would keep them employed. Mothers of school-aged kids spent 3/4 of their work time simultaneously taking care of children, 30% more than fathers, the study found. And in an economic fallout unlike any in American history, women left the labor force in record numbers, citing access to childcare as a key driver in their departure from the paid workforce. And if being a mom isn't challenging enough, pregnancy and giving birth in a pandemic has been accompanied by new layers of complexity, uncertainty, stress, and risk. The pandemic has pointed to so many health and economic disparities, and maternal care, health, and birth outcomes is just one of many. Our pandemic-raised awareness has created a degree of progress and heightened urgency in addressing disparities, particularly the Black maternal health crisis in the U.S. And while clinicians and innovators around the world are aware of and diligently working to save moms and babies, one clinician in particular is using a legislative approach to innovation. In this episode, we hear how with infectious enthusiasm, nurse and Congresswoman Lauren Underwood is using her legislative role to build bipartisan coalitions, author comprehensive legislation, and increase the number of nurses in policy-making roles.
I'm doing okay. I'm delighted to be here, and this is a very timely opportunity to have this conversation.
What we want to do is learn more and particularly amplify your genuine enthusiasm for the power of policy and legislation to change, to improve, and to save lives, and also to join in the celebration for National Black Maternal Health Week.
Yes.
And wow, a White House proclamation.
A pleasant surprise, obviously, but we didn't know that was coming. And I think it represents so much progress that we have the first Black woman to be vice president of the United States, that she is such a longstanding champion on this issue, and that we could have such vocal and high-profile support from the Biden-Harris administration as we seek to save moms' lives. It's incredible.
Representation matters, right?
It's huge. It's everything these days. Yeah, it's so important.
It is. And, in the proclamation, I'll just take a couple of lines. In the United States of America, a person's race should never determine the health outcomes, and pregnancy and childbirth should be safe for all.
Yes.
However, for far too many Black women, safety and equity have tragically been denied. This week, I call on all Americans to recognize the importance of addressing the crisis of Black maternal mortality and morbidity in this country. And I want to highlight this line: ensuring that all women have equitable access to healthcare before, during, and after pregnancy is essential. You just talked about how there's so much progress that is being made. And this is a moment to celebrate, but we are celebrating in the midst of a crisis. And that's one of the things that you have been so vocal about, and using the fact that healthcare, and health insurance coverage has been the top of our national agenda for everybody. It was a huge influence on your decision to run for Congress. And it's one of the things that really influences your legislative agenda.
Yeah. Let's talk about the Black maternal health work first. So the data has been so clear. I'm a nurse, and in my clinical education, we were taught almost as like a fact in passing that Black women were more likely to die. They would say things like, there's just something about Black women where they're more likely to die of pregnancy-related complications, as if that was a fact that would never change. And that ambiguity is dangerous. We need to be much more specific about what's happening. And what's happening in our country is that Black birthing people are 3 to 4 times more likely to die from pregnancy-related complications than white women. And in my state of Illinois, they're 6 times more likely to die. And for every death, there are 70 near misses, 70. So we're talking about this dual crisis of maternal mortality and extreme morbidity, right? Severe morbidity. I came to this after losing a close friend of mine. Dr. Shalon Irving was a classmate of mine in my master's program at Johns Hopkins. We did the Master's of Public Health program together. She was a dual PhD, a gerontologist and sociologist, who was a lieutenant commander in the United States Public Health Service Commission Corps. She was working at CDC on a health disparities project when she found out she was expecting, and she was so excited. This is her first baby. And she delivered her beautiful baby girl, Soleil, in January of 2017. And then 3 weeks later, we lost her. She died from complications related to her pregnancy. And it was devastating. It took every single fact that I knew about this disparity and made it extremely personal. And I remember sitting at her service in Atlanta, and the acting CDC director came to her funeral. Dr. Shuckett came, and she was just talking about how devastating it was. Because we all know these facts, right? We know that this disparity persists regardless of income and education and prenatal care and insurance status and all these other things, right? We know that. But when it happens to you, it's just shocking. Unfortunately, because of the rates of mortality and severe morbidity, this is this unfortunate reality that connects so many Black women in this country. Yeah. And so I had not made a decision at all about running for Congress when she died, when Shalon died. I had just finished up my service in the Obama administration. But when I ultimately decided to run for Congress, and when I won my election, I knew that this is something that I wanted to work on. Now, to have the opportunity to develop not just one bill, but a comprehensive solution like the Momnibus is something that just continues to blow my mind. I teamed up with Dr. Alma Adams. She is a congresswoman from North Carolina. And we wanted to work on this issue together. And so because it's Congress, we gave ourselves a name. And that's where the Black Maternal Health Caucus came from. I thought it was just going to be the two of us, to be candid with you. But when we launched, there was so much excitement. I mean, we had the majority leaders standing with us. Barbara Lee was with us. Joe Kennedy was with us. Carolyn Maloney was with us, right? Like these incredible leaders on Capitol Hill stood with us. And then it was bipartisan. And then we grew to over 100 members, and it became such a thing. We got this influx of press attention and interest. We got all this outreach from provider groups and activists and industry. Companies were reaching out like, how can we help? And it was just this really intense moment in time when we had to make a decision and say, this went from let's raise awareness and let's try to get something done to, oh, we've identified something that people have been really desperately seeking an avenue to drive change forward. How are we going to create a structure that allows us to work with these incredible stakeholders and partners and develop legislation that can be transformational? We quickly pivoted and recruited this incredible fellow to our office who ran the Black Maternal Health Caucus for a year. Yeah. So in 2020, when we first introduced the Momnibus, it was 9 bills to comprehensively solve this crisis. We introduced it with then Senator Kamala Harris. She was our Senate lead, and it addressed everything from workforce issues, right? Growing and diversifying the perinatal workforce to dealing with this data collection issue that is happening all across the country. country, the maternal deaths are actually underreported. So as devastating as the statistics are, and as every story is, we know that there's so many more that we don't know anything about because of these data collection problems. We have a bill to address telehealth, one to deal with mental health, which is now the leading cause of maternal death in my state in Illinois, suicide and substance use overdose. And we have legislation to help incarcerated moms and veteran moms and social determinants of health and funding for community groups. We have bills to deal with innovative payment models, recognizing how much payment policy influences how health systems operate these days. 9 bills at that time to comprehensively solve the problem. And so we introduced the Momnibus, and then literally 10 days later, COVID comes and shuts down everything. Very quickly in the COVID pandemic, we saw that pregnant people, lactating people, postpartum people were not being included in clinical trials. Problem. We saw that people during labor and delivery were not being able to have their support person in the delivery room with them. That could be a partner, it could be a spouse, it could be a doula. And these women were forced into really challenging situations, and they were alone. And I think that was particularly devastating because for Black women who knew going in how risky this could be, right?
You just increased your risk again.
Yes, and increased the level of stress and anxiety and uncertainty, and the need to have an advocate, the need to have a champion is something that is very much acknowledged. And so when that is taken away, and you have a pandemic. And at the time, right, the early days, we didn't know how COVID interacted with pregnancy. We later learned that it's pretty devastating. The intersection between COVID-19 pregnancy and being a person of color, being more likely to get severe COVID-19 illness and more likely to have negative maternal health outcomes if they're infected. And so we quickly introduced a new bill with Elizabeth Warren. It's called the Maternal Health Pandemic Response Act to deal with these unique COVID-19 issues. So that was a standalone last summer. We were trying to get it in these different COVID relief packages. But when we had an opportunity to reintroduce the Momnibus this year in February, we had a new Senate lead, Senator Cory Booker, who is a fantastic partner. Fantastic. He's great. And we are now up to 12 bills. So there's not just that one COVID bill, there's another, the Maternal Vaccination Act, recognizing that even for routine immunizations, we didn't have great funding sources or educational programs to educate pregnant, postpartum, and lactating people about the importance of immunizations during this critical period and the impact on mom and baby. And so there's a bill introduced by Terry Sewell that deals with that. And then last summer, there was a JAMA article that came out that said that extreme heat and air pollution are linked to negative maternal and infant health outcomes. And so I was like, oh my God, we need that in the Momnibus. So now we're up to 12 bills to comprehensively solve this problem. 3 of the 12 are bipartisan, which is very exciting. And we've had our first legislative hearing on one of the bills. And so we're moving forward. We're up to over 130 co-sponsors in the House and the Senate. And when I think about this issue, so often we're asked to solve problems that don't have solutions or don't have obvious solutions or don't have evidence-based solutions. This is not that kind of a problem. This is a problem that has a solution. It's called the Momnibus, and we just need folks to support it. It will make a huge difference. We will absolutely save lives. And it's like my favorite thing to work on. I'm so excited about it.
Your enthusiasm comes through. And I think out of all of the people on the congressional floor, you bring a level of enthusiasm that's also backed by data and science. Yes. And this is legislation that is driving innovation. Mm-hmm. It is matching our policy with our science and our data. It's entirely innovative in its comprehensiveness. And to your point, legislatively strategic. Sometimes we don't see that. And it's setting this regulatory framework that's going to enable and encourage all sorts of other innovations and progress. Have you got some observations on how we can think about legislation as being a tool for innovation, how it helps to scale, how it helps to solve a health problem, but also our economic situations?
Yeah. To your innovation point, here's what we know. We don't legislate in a vacuum. and members of Congress put things on the agenda, raise issues. It's not that there's somehow that Congress just intuitively works on the most important issues facing our country. No, Congress works on the issues that members raise. And so when we have an opportunity in partnership with stakeholders like experts, clinical experts, leading researchers, when we have the opportunity to work with advocates and leaders in industry across sectors, right? When we talk about maternal health, we're talking about a large segment of our economy and folks that are supportive of our efforts. I mean, even during Black Maternal Health Week, we've gotten outreach from pharmaceutical companies, consumer good companies, transportation companies, and the tech companies, and health insurance companies, right? There is a larger economic footprint that's at play where folks definitely understand the need for change and the impact on their business. And so while we typically talk about the Momnibus issues in terms of just the impact on this specific disparity, the larger impact cannot be understated. Typically, people talk about healthcare reform in terms of costs, as if it's a drain on our economy or somebody is making these investments and we hope that they pay off. No, this is like an investment that you know that you will see returns several times over, and that the economic impact is not negative. It's actually positive, and you see that as a result of the engagement that we have with so many leaders in many different sectors of our economy.
And let's give a very specific example of that, the Medicaid extension. So as we mentioned, where we lose moms after pregnancy is the postpartum period. When they're in the hospital delivering, we've got a full suite of teams around them. We lose more moms and babies in the postpartum period, in the after period. So this extension of Medicaid that allows for coverage during the postpartum, we know statistically, evidence, experience, everything tells us that that is an investment that will save lives.
Yes.
So I think that that's a perfect example of your point.
You know, what we know, the data tells us that 1/3 of maternal deaths are happening during labor and delivery. 1/3 are in the immediate postpartum period. And then 1/3 are in the extended postpartum period, which is why it's so important to extend Medicaid coverage to the full year postpartum instead of having coverage cut off 60 days postpartum. And then mom is knowing something's wrong or not quite right. And we have votes to all of our listeners. And so we have these bells that let us know it's time to vote, but we're just power forward. We don't have to stop. We can power forward. Okay. So the data tells us that this is a good solution. The other piece about Medicaid that I think is important for this conversation is that the Medicaid program pays for 2/3 of all deliveries for African Americans in this country. 2/3, 66%. So if you were going to do any one thing to save lives for Black moms in this country, that's what you would do, is extend Medicaid. However, we're talking about how to comprehensively solve this problem, recognizing that it's not just low-income women who are more likely to die. The dangerous part of this disparity is that it persists regardless of income level. It persists regardless of education level. It persists regardless of if you are insured or not, if you got prenatal care or not. And so we can't just stop at the Medicaid expansion. We need to have solutions like the Momnibus that are going to solve all dimensions of this crisis, including clinical and non-clinical factors, those social determinants of health, to make sure that we are creating an environment that helps improve the health status of everybody. So while we're having this conversation about a disparity impacting Black women, we also know that when you do these things, it helps all moms. All babies, right? And so when we talk about equity, there's some people who are just like a little resistant of that notion, and they think that they will lose because others benefit. And that is not at all the case, particularly on this issue.
Yeah. When we center on the people who are most hard hit by a problem, everybody benefits. Listening to you, it becomes very clear that your clinical training, your expertise, your experience is vital, pivotal in crafting the legislation. You're sitting on a couple of committees, Veterans Affairs, Appropriations. What are the other ways? What are some other legislation where that nursing instinct? I think there is a lot of instinct. There is also intuition, but there's definitely the training, the data, the science, the practice. How is it that you're influencing legislation that surprised you, that surprises others? Who knew that a nurse needed to be involved with national security or with
absolutely.
Yeah. So speak to that.
Okay, so very early on in our clinical education, we learn about the nursing process in terms of critical thinking. We do an assessment first, and then an intervention. And then guess what? We take the time to evaluate. Did it work? What do we need to change? And that basic framework is something that is innovative in policy circles. Folks don't take the time to do the assessment, particularly an unbiased assessment. They don't take an opportunity to consult the literature. So to be a data-driven, evidence-based policymaker is something that people just step back and they're like, oh, like that's a very different approach to the job. So when I got to Congress, I didn't have an opportunity to serve on a healthcare committee, one that had the primary healthcare jurisdiction.
Right. Mm-hmm.
And so I had to find opportunities to do the work to improve the health and well-being of the American people from the positions that I had. And so I had to be creative. And I was serving on the House Homeland Security Committee, and we were working on U.S.-Mexico border issues. And I was on the border touring one of the detention facilities, and we had jurisdiction over Border Patrol. And this is during the time when the news was telling us every day how people were being kept in unsanitary, inhumane conditions. And I visited, and you're talking to these officers, and if there was a healthcare provider in the facility, they are charting on like the equivalent of a Post-it note. So folks come across the border with medication, with healthcare ailments, chronic conditions. They come across the border with active infections. And there's an assessment done, a clinical assessment. And it's as if that scrap of paper was supposed to keep up with that person as they were being transferred from facility to facility. There was no electronic medical record. They were in and out of hospitals being discharged. No one knew what those discharge instructions were. If they were being prescribed medication, no one knew what medication they were being prescribed, much less the frequency that they were supposed to receive it. It was a complete disaster. And we knew that children had been dying because of fragmented care that they were receiving under U.S. custody. And to me, that was unacceptable. There is a solution to that. So what did we do? We wrote a bill to put forward some standards in terms of how children were going to be treated and cared for while in U.S. custody, and to make sure they had this electronic medical record. Hello, we have the resources. And guess what? We got that signed into law by President Trump.
And I will say, watching those hearings, your questioning to the leaders there, has anyone here addressed the social and emotional needs of these children?
That's right.
And it was a sobering moment. And I was looking around, everybody, it felt like they were talking about the logistics and the policy and forgetting these are actual children who must be frightened. So when I watched that, that was one of those moments I'm thinking, if you have an issue that involves health or human experience, you need nurses.
Yes. We need nurses in all of these spaces in our political process. And so often nurses have opted out of politics. And that is one of the things that I am personally working to change and make sure that as a profession, we understand we have the expertise. There's nothing more that we need to learn. We just need to feel confident entering into these spaces and sharing what we know to be true. And it doesn't mean that you have to quit your job and run for Congress for 2 years and spend half your time in Washington. But it means that you have a health department in your community.
Yeah.
And that health department is overseen by maybe a county board or a board of health. You should be serving on that body. We are in a pandemic, and our community needs your leadership. They need your leadership.
Well, and I was thinking about that. You started your career very early in your teens, and it wasn't in what we think of as traditional healthcare. You were over in housing. And oftentimes when we talk about legislation as an innovation tool or making policy, that conversation or where our mind goes is at the federal or even the state level. There's institutional policy levels. There are municipal schools. So you're one of the rarities in Congress where we have the nursing perspective and expertise. In our legislative agenda, what other disciplines and expertise do you think need also to be there so that we can have better solutions that really understand the complexity of the challenges that we're trying to address and solve?
Representation is huge in government. We should have a Congress that reflects the lived experiences of the American people. In the broadest sense, we talk a lot about gender. We need more women in office. We talk a lot about race. We don't talk about age as much. We have a small but growing cohort of millennials in Congress, and it's made a big difference. Also, though, in terms of professional background and experience, we bring our full selves to these roles, our full selves. My community knows that they elected a 34-year-old Black woman who's a nurse, and they know that they elected me to Congress, and I bring all of that lived experience to my work. And my lived experience is very different than a lot of people in my community, but we can talk. And guess what? We share values. And so we're able to do this work in partnership. And it's not about what I want. I want to be very clear about that. It's not about what I want, but I see things through a different lens than some other people who have served in this body before. And so I've been uniquely impactful. I use some skills that I gained very early in my clinical education. Do you remember when you first, like in that first clinical skills course, you learn how to walk into a patient's room and establish trust? Because without that trust, you're not going to have a therapeutic relationship. You learn how to walk in and say, "Hi, I'm Lauren. I'm your nurse today. How are you doing?" If that patient's nonverbal, you do it with their family member who's there, because that is the key throughout that shift. And it's the same type of interaction I have with my constituents. They come to me and they're like, "Lauren, I need help." I'm not the first person they've called. I'm not the first person they thought of. They're coming to me as the last resort. And people share such intimate details about their lives. And it's the same skill set. And it feels the same way. You know, there's like a physicality to our work as nurses.
I think what's interesting that you just you shared is that your constituents come to you and they say, "Lauren." They're coming to your office and what you've been elected to do. Mm-hmm. But the way you've presented that, they're coming to you as the human.
Oh, yeah, for sure.
As the nurse, mm-hmm. who they're pretty clear, like, A, you're going to understand this problem. B, you're going to care about it. And probably more because you're a nurse, you'll get stuff done.
Right.
The congressional role gives you the power, the authority to be able to open up those different doors.
And it also means that different types of people are comfortable walking in the door.
Yeah.
And that also is something I'm really proud of, that we've been transparent and accessible to folks, even kids. Our interaction with kids is very different than I think some other members have, because they feel comfortable asking questions and being involved and offering their opinions. And we create safe spaces to engage.
Yeah. And on that topic, the pandemic has forced all of us to do things differently. Everybody has flipped to remote work. We've had to embrace a lot of different innovations. I'm curious, as a congressperson, what have you learned from the pandemic that's made you do your work differently and hopefully even better, and given you access to people that maybe would not have?
What's been interesting is, we touched on this earlier, that the pandemic has shined a bright spotlight on longstanding inequities, longstanding problems, and things that have just been overdue for intervention, right? So our nation's public health infrastructure, for example, had been chronically underinvested in. People had been working at the top of their capacity. Our public health nurses working at the top of their capacity. And then you put a pandemic on top of it and expect all the routine surveillance and other activities to continue forward. What the pandemic has taught me is that we have to be so clear about the problems and the solutions. Even if at the time it might seem like there's no pathway to actually solving that problem politically, it doesn't mean that the solution is wrong. And if we are careful to do the work to identify solutions that make sense and will work, the political winds can change at any moment. And so my example here is, let's talk about nursing, and let's talk about the future of nursing and where we need to go as a profession. I worked with a colleague in the Senate to introduce the Future Advancement of Academic Nursing Act, which would put forward $1 billion, billion with a B, for nursing education in this country.
Wow.
And when we first brought it up, people were like, "That's crazy." But it's like, well, how much do we actually need? The thing about the nursing workforce is that we as individuals are being asked to fund and sacrifice for many years to support our education so that we can serve our communities and meet the very high demand that our country has for our services. The physician workforce is not being asked to completely fund their own education. And there is a large measure of public support and financing that goes into clinical education for physicians that we do not enjoy as the nursing workforce. And as a result, we continue to have these kinds of shortages and challenges in advancing not only the clinical side, but the research side, the program development, evaluation side of our work, et cetera, right? We know that our schools of nursing have been chronically underinvested in.
Thank you so much.
Thank
you for your expertise and your science, your humanity, your service, your representation, your incredible enthusiasm and energy. It's very healing. It's uplifting. And it's uplifting to hear your analysis, the solutions, and you make the future feel hopeful. You say that you're representing the 14th District of Illinois, but I have to say, it feels like you're representing all of us and you're leading so many people. Is there anybody that you might like to have a call out to from the standpoint of thinking about all the mothers that we need to love, support, show our appreciation, and put legislation forward to make sure that they're safe and healthy?
Let's end this conversation where we began. As we think about Mother's Day, let's think about all the expectant moms, the moms who recently experienced loss. The families that have lost that mother, those who are grieving those special maternal figures in their lives, aunts, aunties, the cousins, the big sisters, and then the great women in our lives who we've lost during the pandemic. This has been an extraordinary time of grieving and sadness and loss in many different ways. So I always like to keep those families in my heart as we also celebrate moms and those that are still living and acknowledge their incredible contributions to our lives and our opportunity to feel the range of joy and comfort and belonging and peace and happiness. I hope any mom that's listening knows that we love you, we appreciate you. I hope that those closest to you make you feel all the feels today.
You are the right woman, nurse, and congresswoman for this moment.
Thank you.
Thank you so much, Representative Underwood. As a nurse and congresswoman serving Illinois' 14th district, Lauren Underwood is using her expertise to shape public policy that improves the health of all Americans. Influenced by her lived experience, she's raised awareness of the Black maternal health crisis within Congress and across the country. As the founder and co-chair of the Black Maternal Health Caucus, she's been outspoken and enthusiastic as the lead in drafting legislation to address and improve the health experience and outcomes for moms and babies in populations that experience particularly high rates of maternal and infant mortality. The Black Maternal Health Momnibus Act of 2021 has grown to 12 bills and aims to comprehensively address every dimension of the maternal health crisis in America. It's ambitious, comprehensive, and it is overdue. There's an interesting history of Mother's Day as being a catalyst for improving the health, well-being, and welfare of mothers, children, and women. Motherhood, with all the fun, fulfilling, and happy parts, is a lot of the time just really hard work. It's joy and fatigue all at the same time. But much of that hardship is not naturally a part of motherhood, and mythologizing motherhood as innately difficult overshadows the systemic lack of support for mothers, bias in healthcare, domestic inequity, workplace policies that disadvantage women and mothers, and a host of other social and political reasons why motherhood in the U.S. is more taxing than it is in other countries. In a recent New York Times article, the eminent labor economist Betsy Stevenson stated, "We've had 50 years of the revolution of women entering the labor force, and the most basic necessities that make it possible for parents to fully participate in the workforce are still missing." She added, "When it comes to offering this type of support, the United States is an outlier compared to almost every industrialized country." She emphasizes it's absolutely stunning. This is where nurse and Congresswoman Lauren Underwood's work is a particularly innovative and profound intervention. She is pursuing systemic policies that provide comprehensive, holistic maternal care that is free from bias and discrimination by addressing systemic barriers across the board that will improve outcomes for Black mothers and their families and make our entire country stronger, healthier, and more prosperous. As Representative Underwood reminds us, nurses are trained in assessment, intervention, and evaluation, skills essential to crafting unbiased, data-driven, evidence-based policies. She brings this training, her intuition, her perspective, and her whole self to the problems we are facing as a country, and urges nurses to opt in to policymaking roles and bring data-driven analysis to innovate and legislate to solve our country's most pressing problems. As she emphatically states, your leadership in policy development is needed at every level, and now more than ever. So let us close where we began, in the midst of casting consequential votes. My vote is for policies that ensure mothers and maternal figures everywhere have what they need to make every day a happy and healthy Mother's Day. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.